Hello everyone. I chose Demystifying Peri-Implant Maintenance, and this lecture was by Eddie Gibson, who is a registered dental hygienist. She also has a master's in science. Eddie Gibson was very educated about implant disease. She was intrigued by the topic because in hygiene school she did not learn much about implant dentistry, and after getting a patient with a subperiosteal, she didn't know what to do and wanted to make sure she was educated and those who were in a position like her were educated on this topic as well. I took this class with Michelle on Friday, February 26th at 10 a.m. and the lecture lasted about 1 hour. This topic was interesting to me because I do not see many patients with implants, but I would love to be knowledgeable and get ready when the time comes, especially with me becoming a dental hygienist in the near future. The goals for this class is to recognize the signs and symptoms of peri-implants and the subdivisions, for example, mucositis, implantitis, and cementitis. Another goal is to develop assessments and treatment protocols for peri-implant diseases. What is an implant? It is a screw-like structure that is made of titanium that is embedded into the bone. It can replace a single tooth or multiple teeth. Our natural teeth versus an implant are similar in many ways, except for the fact that implant disease destroy implants faster compared to periodontal diseases in natural teeth. As stated before, there are 3 different types of peri-implant diseases: mucositis, implantitis, and cementitis. There are 43 to 63% of the population who has had mucositis, and 18 to 22% of people who have had implantitis. In 2017, they have created a guideline for peri-implant diseases. Ms. Gibson has placed a simplified peri-implant disease classification on her PowerPoints on what to look for and how to take care of a patient with what they might have. For a patient with a healthy implant, what you're looking for is no bleeding, pus, or bone loss, no inflammation, PDs remain constant from baseline, and we should see the patient 4 to 6 months for recalls. For a patient with mucositis, there is bleeding on probing, no bone loss, no exudate, and we should see the patient 3 to 4 months for their recalls. A patient with implantitis has bleeding and exudate, 2 millimeters bone loss, pocket depths of greater than 5 millimeters, and we should refer for eval. For the last classification, hard and soft tissue implant site deficiencies, post-tooth loss, diminished alveolar bone ridge, resulting in hard and tissue deficiencies, larger deficiencies due to extraction, endo-infection, root fractures, thin buccal plate, poor tooth position, and injury. Others have to do with medication or systemic diseases. What is cementitis? It is excess cement around the implant, which is known to destroy the implant by 75%. With cementitis, it can be seen the signs within 4 weeks. You cannot see cement on an x-ray, so it is very hard. So that's why once a implant cap is on the implant with cement, you must take off all the excess cement prior to letting your patient leave the office. How do we help with a patient who has an implant, either diseased or in a healthy state? Ms. Gibson was very into the guided biofilm therapy, which you can see in the photo. It is almost like the dental hygiene process care. In the first step, we're looking for the gums. We are probing and we are checking the mobility just as we do for natural teeth. The second part is disclosing of the teeth to see where the patient needs more help with OHI. As we do for patients with natural teeth, we always want to motivate our patients to do better when they are cleaning. Either it is teaching them how to floss or properly brushing and angling their toothbrush. The fourth step is air polishing. It has been shown that it is a lot better than using chlorhexidine because the air polishers can take off the biofilm from supra and to sub. After airflow, it is perial flow. This is a lot better for the pockets that are deeper than 5 millimeters. The sixth and seventh step are the piezon and to check. With the piezo, you would need a specific tip for implants. And after you have completed it, you will need to check if there's any leftover calculus on the implants. What instruments should you use for an implant? You should use titanium or plastic instruments. The final step is recall. In health, it is a 4 to 6 month recall, mucositis 3 to 4 months recall, and implantitis you should refer for eval. A lot from this lecture was a review, but I will take with me is the guided biofilm therapy 1 through 8 because that is something that I did not learn for a patient with any type of implant. And I appreciate all of the things that she had taught. The CE code for this lecture was 9742. Thank you for watching, and I hope you learned something just as I did.